Today we'll talk about hip bone. We'll be doing it in different parts. So let's begin the first part. So hip bone is a large irregular bone. It is made of three parts: ilium, pubis, ischium. So let me tell you the different aspects, anatomical aspects: superior, anterior, posterior, and the inferior aspect. And these are two hip bones with the sacrum forming the pelvic girdle. This is right hip bone. This is the anatomical position of the hip bone. The three parts of the hip bone joined in a cup-shaped hollow area, and that is the acetabulum. Pubis and the ischium are separated by another opening here, that's called obturator foramen. Acetabulum articulates with the head of the femur to form the hip joint. The pubic parts of the two hip bones meet anteriorly to form the pubic symphysis, as we can see here. The two hip bones form the pelvic girdle or the hip girdle. Side determination: acetabulum is directed laterally. A flat expanded ilium forms the upper part of the bone, and that lies above the acetabulum. Obturator foramen lies below the acetabulum. So this is the obturator foramen and this is the acetabulum. So it lies below the acetabulum. And so this is the right side hip bone. Anatomical position: the pubic symphysis and the anterior superior iliac spine should be in the same coronal plane. The pelvic surface of the body of the pubis, that is this area, is directed backwards and upwards. The symphysis surface of the body of the pubis, that is this area, it should be lying in the median plane so that it forms pubic symphysis. Ilium. So let's talk about this part. Ilium or flank forms the upper expanded plate like part of the hip bone, and the ilium has the following parts: upper end, which is called the iliac crest; lower end, which is smaller and is fused with the pubis and the ischium at the acetabulum. This part is fusing with pubis and the ischium in the acetabulum. There are three borders: anterior border, posterior border, and the medial border. And three surfaces: gluteal surface, iliac surface or the iliac fossa, and sacropelvic surface. Talking about iliac crest, it's a broad convex ridge forming the upper end of the ilium. There are curvatures on the iliac crest. Vertically, it is convex upwards. Anterosuperiorly, it is concave inward in the anterior part and concave outward in the posterior part. The highest point of the iliac crest is situated little behind the midpoint of iliac crest. The anterior end of the iliac crest is called anterior superior iliac spine. The posterior end of the crest is called posterior superior iliac spine. Morphologically, the iliac crest can be divided into a ventral segment, which is large, and a short dorsal segment. The remaining things we will be talking in the next class.